So we're going to move on to our last speaker of the session. This will be a presentation on the impact of individualized patient education materials and patients' cancer care experiences by Leah.
All right, I think I'm wrapping up the oral presentations, and as an in-person attendee today, I think it's been a fantastic day. So thank you to everyone, and I hope to kind of round out the show with my presentation. So my name is Leah. I'm a PGY2 at Rush, just about 10 minutes down the road, and I'm going to be discussing the impact of individualized patient education material on patients' cancer care experiences. Just a brief outline of what I'll be covering today. So overall, we know that patient education materials, or PEMs, as I may say, empower patients to understand their health and their available treatment options. But a lot of the existing patient education materials that are out there actually exceed our national readability recommendations, which are at a 6th grade reading level. We can see an example on the right of an existing innovative resource that's put together by the ROECSG group, as we just outlined, or we just heard about the CBRE initiative itself. But these resources are pretty limited and far and few in between. The existing ones that are out there, are mostly in oncology, are very comprehensive, text-heavy, often requiring you to have multiple click web-based internet resources going down a rabbit hole, if you would, and lengthy, requiring a large amount of information of processing. And so revised patient education materials at an appropriate health literacy level targeted for new patient visits can facilitate us to improve our provider-patient communications and address the disparities in health equity brought about by some of these sociodemographic factors. As I started my first year, or as a PGY2, rotating through the different services at Rush, I realized that we serve a very diverse population, not only of different economic backgrounds and racial backgrounds, but also of different languages. And I thought this would be a wonderful opportunity for us to take advantage of this population and really figure out how can we cater towards their needs. And so this project focuses on, does the integration of a patient education material tool that's developed at appropriate health literacy level improve patient satisfaction at the time of a new patient visit? The primary outcome is to really assess the mean difference in patient satisfaction between our control and our study groups, which I'll describe in more detail. And then secondarily, to really assess, is there any sort of interaction effect between health literacy and overall effect of the patient education material on patient satisfaction overall. This study is designed in a very simplistic, prospective randomized control framework with a block randomization, and that was simply decided for the ease of use in our clinical practice. Our control group receives a current standard of care as they would with any physician encounter, where the physician may just walk into the room and start discussing verbally the diagnosis or what their overall prognosis is. The intervention group will receive not only in addition to the traditional encounter, but this specific tool or worksheet that we've created for them. The patient education material tool was designed in collaboration with our education committee at Rush and also with our media designers, and it was put against a test of readability against 10 measures to make sure that we were actually kind of preaching what we are, practicing what we're preaching, in the sense that our health literacy of the actual worksheet was appropriate for our patients. Our inclusion criteria included English and Spanish-speaking adults, 20 years or older, and these were specifically piloted during new patient visits during our multidisciplinary comprehensive thoracic clinic. Our analysis tools are really just focusing on control and intervention surveys. These are very similar for both groups, encompassing demographics, validated health literacy questions, and validated patient satisfaction questions, and then with the addition of a few patient education material specific questions for the intervention group who would have received the worksheet. We're employing descriptive statistics to really characterize our control and our study groups, and then utilizing 2 sample t-tests with a one-sided alternative to measure any mean difference in the score of patient satisfaction between the control and the intervention group. And then finally, really focusing on if we're going to be able to find any impact of health literacy on the correlation of how they viewed that patient education material with the use of interaction tests. So here's a sample of the tool that we did produce, both available on the left in English and on the right in Spanish, really hoping to break it down in a visually, graphically appealing way to patients. So I'm sure many of you have had patients in your encounters where patients are scrambling to write down how do you spell squamous cell, and they're focused and caught up in that moment rather than, you know, comprehending a larger picture and really hearing what you have to say as well. So our goal was that we'd be able to provide them with a worksheet that they can take away at the end of their encounter, especially during the time of COVID when we weren't even allowing family members in the room as well. So that they could share that information with their family members at a later time. It talks about the treatment options available as well, and then walks you through your team who it will involve, because in these multidisciplinary clinics, obviously, multiple providers at one time, quite overwhelming for the patient experience. So I'm sharing with you preliminary data so far. We only have a small N of 23 and our data collection is still ongoing. But what we can see so far is that, you know, we've had characteristics including our gender, age, and education. And the health literacy was scored against the brief education health literacy tool, which is a four-question validated survey, which really helps to group, are patients able to read any documents that are medical related, or do they need a significant amount of help when reading these things? Again, really focusing, this is just specifically on the intervention group. The specific patient education material questions that we had, we're really looking to pull apart what components of that worksheet worked for people the most and trying to determine if it was the diagrams or the language that we used that facilitated. And here I'm just sharing some of our preliminary numbers, but obviously our N is very small, so hard for us to draw any conclusions from at this point. What we, hope to do is that keep going in terms of our data collection. And then what we'd like to see is that if this is something that can be applied to other sites, there are other worksheets out there, but one of the biggest things that was a barrier for us to use that in our institution was that they're often very much funded and labeled by the pharma companies. So their logos are plastered on this. And so, while our worksheet has our Rush logo on it, our overall goal is that at the end of the day, if these are worksheets that other institutions can use, we can remove our logo and make it accessible to everyone to use as well. Thank you.